First of all, Ciarán, I just want to extend my sympathies to Deputy Michael Collins as well and the very tragic loss of his nephew. And my thoughts are with his family, with Michael's family, friends and his wider community. I'm grateful to have the opportunity to talk about the provision of healthcare and GP services in rural areas. In Cork South West, we are very familiar with the pressures and the failures in our health services in rural communities. The blunt truth is that the current GP model is not working and has not worked for a very long time. The GP contract is over 40 years old and is completely unfit for today. It requires GPs to set up a private practice. The actual medical work of a GP is hard enough without forcing doctors to also deal with the pressures of running a small business. It puts medical graduates off the roll. An ICGP survey in 2019 showed that only 26.9% of graduates wanted those responsibilities of running a small business. The HSE can't just keep hoping that this problem will fix itself. We need an alternative model. The HSE have to take responsibility for community healthcare and provide salaried HSE positions for GPs who want to do the work but do not want to take on the incredible workload of running a practice. We also need to see multidisciplinary GP teams built up, nurses, pharmacists, healthcare assistants, all working together within general practice. This is especially important in rural areas. There are GP practices in my constituency who are 2 hours away from the nearest trauma centre, obstetrics unit and surgical unit in Cork City. Putting that pressure on lone GPs is completely unfair, unrealistic, and it puts patients at risk. Out-of-hour GP services are running on a skeleton staff all across the country, but especially in rural areas. A salaried model would mean that salaried GPs could work those out-of-hour shifts instead of expecting GPs who are already running services during the day, potentially 5 days a week, to also do that work at night on a completely ad hoc basis. It would also offer flexibility that GPs just do not have at the moment. Basic things like part-time contracts, 4-day weeks, a couple of evenings a week, maternity cover, holidays. GPs need a better work-life balance, and this is the measure which would provide it. We can't keep expecting doctors to carry on like this. Last year, Dr. Fiona Kelly, a GP in my constituency in Castletownbere, tried to take her first holiday in over a year. She tried everything she could to get cover, but couldn't, and was forced to close her practice for the day. That's the level of pressure that GPs are under, never able to take a holiday, a sick day, to take a break without having to cancel appointments for patients. These working conditions are ridiculous. She told the Examiner that a typical day for her means dealing with 70 to 100 patients, with consults in person, by email and on the phone. The European Union of GPs recommend that the safe level of patient contacts per day is no more than 25. A salaried model would also make it much more attractive a career for young people. A serious concern in GP services is replacing local GPs as they retire. More than 1/4 of GPs in Cork and Kerry are over 60, and it is incredibly difficult to replace them in rural areas because of the pressures to provide those out-of-hour services. When these practices lie empty, when South Dock services like Skibbereen close their doors and reduce their hours, it is a recipe for disaster. Forcing people in medical emergencies to travel even further to reach an open clinic in areas you'd be waiting a very, very long time for an ambulance. Everyone in rural Ireland knows the pressures that GPs and out-of-hours services are under, but what doesn't help is the absolute lack of transparency by the HSE about these reductions in services. Last summer, when I was first informed that patients from Skibbereen and surrounding areas were being diverted to Bantry for South Dock, I was at my wit's end trying to get a straight answer from the HSE. I had HSE officials swearing there was no reduction in services in Skibbereen South Docks, while the call centre operators were telling my staff that they'd been diverting patients to Bantry for weeks. These are vital services in rural areas, and the absolute least communities deserve is clarity around their operational status and their capacity. Healthcare must be available to everyone 24/7, regardless of their postcode, but it is getting more and more difficult every year to access medical care and pharmacy services out of hours in West Cork. This all comes down to a complete absence of government planning and investment, which has brought the service to a crisis point. The GP training programme needs to be massively expanded. Figures released to Deputy Shortall last September showed that out of 964 eligible applicants for GP training, only 286 were taken on. That is disgraceful. We are crying out for GPs across the country, and nearly 700 potential GPs are being turned away from entering training. Another health service which is under massive pressure in rural areas is dentistry. There are currently only 2 public dentists in West Cork serving the whole area, one in Bantry, one in Clonakilty. I'm contacted repeatedly by desperate parents whose children are in pain and they can't access dental care. The Bantry Clinic is under extreme pressure, with cuts forcing them to operate only on a 3-day week, with staff expected to cover the entire West Cork Peninsula. The situation is desperate. We need to provide affordable dental care to people in our communities. It used to be the children in West Cork would see a school dentist in 1st, 3rd and 6th class. Now appointments are only available in 6th class. So are primary school children supposed to wait 8 years for any dental treatment? There's a severe shortage in dentists participating in the school scheme. In a PQ response recently, the HSE told me there were 28.3 full-time equivalent dentists serving 380 schools across Cork. That is tens of thousands of children being covered by 28 dentists. Is it any wonder parents can't get appointments? The HSE seems to be blaming the failing services on a lack of private dentists participating in the scheme. Another example in the long list of the state outsourcing its own responsibilities to the private sector. The HSE needs to provide these services itself with public dentists. Minister, this all comes down to a complete absence of government planning and investment, which has brought rural health services to a crisis point. I know there's a strategic review of GP services ongoing, and I join my colleague Roisin Shortall in appealing to the Minister to include the possibility of salaried GPs in that review. The government needs to act, and act quickly, to increase capacity in the GP and dentistry systems, to make the professionals more accessible to young doctors, and to ensure GPs can access cover when needed.
Thank you, Deputy.